is it like to have cancer? To be diagnosed with a disease that many believe is deadly? To deal with the physical and emotional consequences of treatment and the effect on your family and friends? What is it like to face your own mortality? What does it mean to be a survivor?
Whose birthday is it? Ethan's. How old are you going to be? Oh, 4 years old. Wow.
Every year, 1.3 million Americans are diagnosed with cancer, and more than 500,000 die of it.
Folks, we have a no-flash rule inside, so if you have a camera and want to take souvenir photos, that's fine, but just please turn the flash off on your camera before you go in for us. Thank you.
But there is a much larger group, almost 10 million Americans, who are living with cancer and beyond it. In this program, the second in our series, you'll meet people who've been diagnosed and treated for cancer. Dean Whitlock learned he had leukemia when his wife was 6 months pregnant.
One of the first things one of the nurses said to me is, well, you certainly have something to live for, don't you?
I'm going to take out all of them, right?
Nancy Speck's doctors had conflicting opinions about how to treat her breast cancer, so Nancy had to make tough decisions for herself.
If you're well person all your life, you get treated in this land of certainty, you know. This medication works or nothing works. It's a virus, you don't take anything, it goes away. It's a bacterial infection, you give an antibiotic. But you get to cancer and you're in this gray zone, and that was overwhelming.
After Shawana Sanders' breast cancer was treated, her doctor advised her not to bear her own child, though she can expect to live a long life.
It's just more about, okay, let's deal with this now and let's get it out the way.
That's true.
With the help of his wife, Mary, Tim Perry had to contend with 2 different cancers.
It was kind of a roller coaster, you know, from the very beginning. I mean, you get a little good news, and then you get a little bad news, and then you get some, hopefully, more good news, and it just, it turned everything upside down in our lives.
Ethan Cutler was diagnosed with leukemia when he was 4 years old and endured 3 years of treatments.
I think cancer in a family can really tear people apart and sort of make everyone go to their own corner and deal with it in their own way. And I worried about the other children not having enough time with mom and dad.
I had a 15% chance of living, and I almost died, but I survived.
When you ask someone like me to answer the question of what is cancer, I would have to say it is probably as unique as there are individuals who are diagnosed. And one of the things that we've seen as we leap into the new millennium, if you like, is cancer turning a corner. The vast majority of people who are diagnosed today are going to live years after their diagnosis.
Don't ask how many people survive. Just know that some people do. And that there's absolutely every reason in the world why you can be one of them.
My story began around mid-March, early April. So this, I think, must have been during the Thanksgiving.
Yeah, that's a good one.
Yeah, I forgot about that one. I began to have pains down the right side of my body, and I just brushed it off as maybe a strained muscle from teaching kitchen dance, or maybe I needed a new mattress. So I ignored it for a while, but the pain kept coming back. So I started to do breast exams. I mean, I did them every other month or so, not quite sure if I was doing it correctly or remembering from one month to the next if I felt any changes, but this time I felt something. The day we found out for sure that it was cancer, I met Otis Brawley, Dr. Otis Brawley, my oncologist.
There's a lot to learn from what happened to Shawana. She's 28 years old, no family history of breast cancer, but she realizes all of a sudden that she has a dominant mass in her breast. Many women just watch that dominant mass. Many women watch it grow and do nothing. The proper thing to do is to do what Shawana did, which is to seek medical attention.
At that point, he said, okay, you may want to think about having a mastectomy done. I was like, whoa, wait a minute, that's kind of a long shot. But the more I thought about it, I was like, fine, just take it. I don't care. You can take both of them, whatever, just get it out of me.
But this did not happen. Before surgery, Shawana had 8 rounds of chemotherapy to shrink the tumor.
The first time I had the chemo, I went in on a Friday and was back to work that Monday. Didn't have any side effects. I was like, oh, I can deal with this, So the next time I went for my treatment, that's when it hit me. So I was actually out for a week from work.
With each cycle, Shawana lost more energy. And there was another side effect, too.
I lost my hair. But I knew that from the beginning, before we even started chemo, that would happen. So I went and bought a wig and took it to my beautician. And I kept telling her, and I was like, Kathy, it's time for me to get rid of my hair. She put her hands through my hair, and it was just coming out. I was kind of like, oh, okay, that's kind of cute. I have a cute little head, So like I said, on special occasions, I've thrown a wig on, but the scarves are just a little bit more convenient and easy to deal with than the wig. But this is me on how I used to look with hair.
After the last chemotherapy treatment, Shawana was scheduled for surgery. By then, her hair had started to grow back, and the chemotherapy had shrunk her tumor to almost nothing.
What they did was a partial mastectomy, which means that they didn't have to remove my breast and I didn't have to have any reconstructive surgery done.
It turned out that all the surgeon had to remove was the small tumor that remained after chemotherapy. Shawana now faces 6 weeks of daily radiation therapy to remove any further traces of disease. And then she plans to get on with her life. Her job as an administrative assistant at a university, her family, her children's dance group. But some of her plans are different now. Her doctor has advised her not to think about having children of her own.
Initially, when I first found out, my doctor told me, think about having a mastectomy and don't think about having children. I'm like, wait a minute, I'm too young to hear that. I want a family. When you become pregnant, your body produces a lot of estrogen, and a lot of estrogen actually can cause breast cancer. So that was his thing. It was just from a health perspective that my risk would increase if I decided to have children, that, it could possibly come back. My boyfriend, he's been really great. If I feel like I want to go through that process, then he's there for me. If not, then we'll adopt. The possibility of reoccurrence has been discussed among my doctors and I, and it's very slim that it will come back. It's not a zero that it won't come back, but there is that possibility. So I am aware of that, and I will continue to check my body more and, just be more in tune and always try to stay a step ahead of anything.
And here we have a young lady who found a very bad problem, came early, got good treatment, and now has a marvelous prognosis.
Childhood cancer sets the pace for progress in cancer treatment. Illnesses that 50 years ago were fatal within weeks are now almost routinely treated and cured. Of the 8,000 to 10,000 children diagnosed with cancer in the United States each year, Approximately 2/3 will survive to become healthy adults. One of these survivors is Ethan Cutler. Ethan was 3 years old when he was diagnosed with leukemia. When cancer strikes one person, it touches many. Ethan's story is the story of a family. His mother, Heather, his father, Rob, and his 4 brothers and sisters. Our oldest, Elizabeth, is almost 13. She's in 7th grade. The next one, Andrew, is in 5th grade. Then David is in 3rd grade. Ethan is in 1st grade. He's the one who had leukemia. And then Catherine is the littlest, and she's in kindergarten. Ethan was sleeping a lot, and he just was just really, really droopy. And I finally decided one morning that I wouldn't send him to daycare. I would bring him down to see the pediatrician. She did the usual routine, and then she sort of said, well, you know, I'd just like to do a little blood work. The doctor asked them to return to the clinic the next day, and that's when the family was told that Ethan had a type of leukemia called pre-B-cell ALL. After making the official diagnosis, she brought us into a room and told us about the leukemia. And although it had started to sort of permeate before then, it was like being in a fog, hearing about it and hearing her actually say it. The day that we were diagnosed, he just then went right into the hospital and stayed there. And they really just bombarded him with drugs.
I went through afterwards and calculated up, and he had 250 or 300 shots over the course of the time frame. And I'm not a big one for getting shots. I don't like it when I go to the hospital, and to watch this little kid have to go through it was very difficult to watch. He was an amazingly brave little kid.
Among other medications, Ethan was given prednisone, a powerful synthetic hormone. One side effect is that it increases the appetite.
He would eat constantly. He went from this, he must have gained 10, 15 pounds within the course of a couple of weeks.
He, for example, would eat like 5 plates of chicken nuggets for breakfast. He would eat these enormous bags of salt and vinegar potato chips. And he had to have the food that he craved. Your image of a person with leukemia or with cancer is of someone who sort of wasted away. But Ethan looked like he was pregnant. He was a little bald, chubby boy for a while, but always smiling. I have a picture of him then just sort of looking over his shoulder with this great big grin on his face. And he would find things to enjoy.
Now I'll get him this time.
Ethan's brother and sister, David and Elizabeth, both have clear memories of his illness.
I was old enough to understand what was happening, so I understood that it was extremely serious, and it was really scary, because he's my little brother, and I love him, so.
I worried about the other children not having enough time with Mom and Dad. As it turned out, I think it had an opposite effect on our family. I think in some ways it brought us closer together.
Just seeing Ethan and knowing that even though he had this disease, that he could cope with it and he could run around and play and be cheerful, even though he had this disease that could potentially kill him, that's where I got my strength, from Ethan.
Even though the children were young, they understood the risks that Ethan faced.
The main risk was that the treatment wouldn't work, and that the leukemia would eventually kill him. But most of the risks actually were treatment-related. The point of the treatment was to kill all of the cells, and that made him very open to any sort of infection. So a cold, any sort of normal childhood disease could kill him.
A year and a half into his treatment, while visiting his grandparents over Christmas, Ethan came down with chickenpox, an ordinary childhood disease, but potentially deadly for someone like Ethan.
On Christmas morning, he didn't want to open his presents, and he had this rash, and so my parents took him into the hospital, and they found out that he had chickenpox and it was spreading to his lungs, so they put him in the intensive care unit and on a respirator, and he stayed there for a while, and it looked as though he was going to die, and it was really scary.
He was on a normal respirator for a few days, and then they put him onto what they called an oscillating respirator because the normal respirator was not getting him enough oxygen. What had happened was that the chickenpox had gotten into his lungs, so it was just getting worse and worse. So he was on the oscillating respirator, which pushed lots of oxygen very, very fast, so very, very fast and shallow breaths into his lungs. And the poor little guy, he was just in there in this intensive care, his whole body, everything covered with these scabs and sores.
The three older children put on masks and gowns and were brought in to see Ethan, perhaps for the last time. On New Year's Eve, the head of the intensive care unit said that, unless things improved, they would put Ethan on a heart-lung machine.
What she didn't tell us until afterwards was that kids don't usually come off heart-lungs, so that was sort of the end of the line. And it was right around midnight on New Year's Eve that it turned around for him. And he started to get better.
I remember asking my parents if he was going to die, and they said no. So I felt a bit better.
It took time and special therapy to help Ethan regain strength, but from then on his recovery was steady. 2.5 years after diagnosis, he had his final outpatient treatment. But as with almost all cancer survivors, especially children, there are still long-range concerns, including secondary cancers and learning disabilities.
He does have increased risk in the future for potentially other kinds of cancer that might have been induced by the treatment. So far, I haven't seen anything.
Okay. Like, is there a long at sea?
I know that some leukemia kids have impaired math skills. That treatment can cause some math-related learning issues. So far, Ethan seems to be okay with that. We didn't have a baseline on him. He was 3 when he was diagnosed, so he didn't have many math skills then.
Ethan's family shared his ordeal, and now they share in his recovery.
It's been very scary and sad, but also it brought me closer to Ethan, and it made me understand him a lot more than I did before.
Let's go!
As a parent sometimes, especially with a lot of children and with busy lives, you can sort of go on and you take your kids to daycare and you go to soccer and you do this and you do that, but you don't sort of always take the moment to just spend time with the child one-on-one, just appreciating them. And the leukemia experience made me more conscious of the need to do that with each one of my children, and more conscious of how precious those ordinary moments are.
Go on, go on!
Sometimes when I look at him, I think, oh my God, he almost died. I can't believe he's there.
So now I can play sports, run around, swim, and do all the stuff a normal 7-year-old could do. I had a 15% chance of living, and I almost died, but I survived.
You go along about your life assuming things are just going to keep going the way they're going, and then all of a sudden somebody tells you you have a terminal illness. It makes a big difference in your life and the way you look at things, and you know what's down the road for you.
I didn't know if I was that good of a person. I was going to love him if he was flawed and defective and, you know, walking around with a cane and losing his hair. Oh, I love him even more.
When Tim Perry was 52, A lump in his neck was found to be malignant. The diagnosis was Hodgkin's disease, a form of cancer that is highly treatable. But then his doctors discovered a spot on his lung. It turned out Tim also had metastatic lung cancer, stage 4, the final stage. It was an unusual situation. Tim's doctors had to coordinate treatments for 2 different types of cancer.
Initially, they were going to try to give me a chemotherapy that would help the lung cancer, but would also reduce the side effects from the Hodgkin's as well. And sounded like a reasonable approach. Unfortunately, it metastasized to my brain from my lung. So we've since had to go with some radiation, and because of that, they've changed my chemo to attack more of the lung cancer itself.
Yeah, keep your chin straight. You don't have to reach the top. I want you to put your arms down by your side. And I'm just going to kind of wing. Whoops, stay relaxed.
Yeah.
Just kind of wing it out a little bit. There you go. Okay. Take another nice deep breath in and hold your breath, please. And breathe and drop your arms down for 1 more minute.
How much pain do you have when you're walking?
Quite a bit, actually, right in that area, right in here.
So on a scale of 1 to 10, if 10's the worst pain you ever had and 1's barely anything, what
It's
number
up
would you
there around a 5 or so, 5 or 6 in this.
You shouldn't have to be in pain, Tim. You know, one of the few things we can do in this setting is help your pain and keep you out of pain.
That's what we'd rather.
Tim and Mary live 60 miles from the cancer treatment center. They had to make a 3-hour round trip every day for radiation treatments to shrink the tumor in Tim's head.
That's going to be a long day, you know. You've got chemo, radiation, labs.
Radiation's been good, fortunately. Once they get you set up initially, it's extremely efficient. Everybody that has anything to do with me knows I'm here when I'm supposed to be here, and I go in, and 5 minutes later they have me out, and I'm on my way back home again.
You want to come across the hall? Better hearing? Okay.
Yeah, fine.
Selective? You know, whatever. It depends who's talking.
Can it be?
Yeah.
Okay.
So
Is there a way at some point to find out if the
Sure.
radiation's working?
Sure. At some point there is. Right now, we go by the good assumption that the radiation is very effective.
Hey, how you doing today?
Good. How are you, Dr. Marshall?
All right. So, how are
Hi,
you?
good.
So, how are we doing with the treatment so far?
Good. Yep.
So that's 2 milligrams, right, Sue? It looks like so much to me.
You know why? Because it's only 1 cc, which would be from the 1 down, but we dilute it down in the syringe so it doesn't sting.
Today's a really good day because, first of all, they're gonna help him a little bit more with the pain meds. His labs were great. His X-ray looked great.
Your case manager RN called Lisa from palliative care. You may not know you have one.
No, I didn't.
When people have some involved illnesses, at times the insurance companies give you a case manager to help get you through the system.
You had a bad day yesterday emotionally?
Yeah.
Yeah. What was up?
I don't know, just
Depressed?
Actually, I ate really well the day before. And I was feeling kind of good, and I just caught one of those glimpses of myself in the mirror that, you don't look so great today, and it just kind of bummed me out.
We know that Timothy, is not going to do well. However, what we can do is help him to feel as best as he can, as long as he can.
We'll make a restaurant make us a picnic. When we first found out that it was a terminal illness, it felt like you were dropped in hell for about 4 days. And then after that, something happened, and we were watching something on TV, and he laughed, and it was like, oh, you laughed. We can laugh, but you're going to die of cancer. And then you start to come up. I would hate people to think if they ever got a diagnosis of terminal cancer, me included, I would hate to think that people are going to believe that their life is over right now. There's never going to be another piece of joy, because it is more about joy with the seasoning of it isn't going to last forever.
I get up every morning and just try to feel as good as I can and get as much as I can out of the day. I mean, it's nice to have like a day like today. It just happens to be a beautiful day, and it was a nice ride over, and enjoyed the view, and just get enjoyment out of everything that you can possibly pull enjoyment out of.
But enjoying the day was not always possible. Tim wasn't strong enough to continue his work as a machinist, which caused a major drop in the family income. And though the family was close, one of their two daughters found it hard to accept Tim's condition and withdrew, as did some longtime friends.
You'll go to the market or something to do some shopping, and you'll see them, and you can see them just, go around the corner, because they catch you out of the corner of their eye and they don't want to talk to you. They don't know what to say.
Partway through the radiation, Tim was given a break, so he and Mary decided to get away for a few days to a campground on the seacoast.
Fried clams will be fun. Lobster will be fun.
We got there on Monday and got settled in, had a beautiful spot right overlooking the ocean. We had a campfire right on the cliff there.
But the vacation did not go as planned. That first night, Tim developed a blood clot in his leg and had to get emergency treatment at a local hospital. Then on their return, the pain in his hip intensified.
My palliative care person, Lisa, was keeping track of things with me and how I was feeling and the pain and stuff, and she said, there's something going on other than just cancer here. I know there is. That's, you shouldn't be in this kind of pain with what you're taking and whatnot. So she got me in for an x-ray, and sure enough, it was broken.
2 days later, Tim had hip replacement surgery. His pain was eased, but after he returned home, things went downhill quickly.
He had sudden bouts of shortness of breath, weakness, dizziness. I just can't remember. There were so many fast, hard symptoms that hit him. And we kind of knew that it may be that fourth stage that he was coming into.
At that point, Tim and Mary decided it was time to stop all treatment and connect with hospice care.
That's interesting. Most people have... Look at these wonderful experts who are hospice workers. They know how to take care of pain and symptom management. They know how to take care of your family as the unit of care. They know how to help you so that you can function as fully as possible, as long as possible.
Tim opted for surgeries. He opted for chemo and radiation. He opted for different drugs that would help him be more comfortable. We finally opted out of the whole business of trying to keep him alive and just let him be comfortable and serene, and that was a real good decision. I was real glad we made that decision.
The goal of hospice, as I see it, and I think my colleagues see it in this area, is to allow the patient to die at home in comfort and with dignity. Ideally, hospice is called in soon enough to arrange for care in the home. In Tim's case, the call came too late for that, but the hospice nurse was able to get him admitted to a special palliative care room in the local hospital. And there, in a comfortable, non-clinical setting, with his family around him, Tim died.
I was chatting, and my daughter Jennifer came out, and she said, "Mom," and this is like 10 minutes I was gone. She said, "Mom, I think you need to come back in the room." When I came back in the room, everything had changed. He wasn't in pain. He wasn't gasping or he didn't have a death rattle or any of that. But his breathing pattern had changed to the point where I knew something is desperately wrong. Just then, when I started to panic, the hospice worker put her hand on my back and she said, "It's time, Mary. It's time."
And she got up on his bed and actually walked him through the process of dying.
I came over to him, and for what I thought was a minute, I gently stroked him. I didn't want to hold him because I didn't want to upset his breathing, but I gently stroked him.
And that's how I came to describe it, as well as the other people in that room, was that we called it walking Tim to the other side, and that's what it seemed like.
I said, "Oh, baby." I said, "Your mom and dad are waiting for you. God's waiting for you to take you home." I said, you gotta let go now, baby. You gotta let go."
He just looked at her and looked at her and looked at her while she was talking to him.
And he took a breath, and he just sighed, and he was gone. And I crawled up on his bed, and I put my arms around him, and his back was still so lusciously warm. And I just talked to him like no one else was in that room. I said, "Oh, buddy," I said, "what a life we had." "Hey, buddy. We still don't have your little stone yet." I do go to a counselor who helps me immensely. But the other thing about grief is it feels very cyclical. It feels like a racing track, a track where people go out and run or walk. What happens is there's a great big hunk of pain and sadness and despair, all kind of formed in this one area of the track. And you walk it and you get into it, and it's awful. And it hurts, and it feels like some kind of illness is all over you. And then, if you keep walking, you're out of it. And you continue on that circle. And then, bang, you're feeling great. You got your air, your endorphins are kicking in, you feel great, you feel strong, you feel like a survivor. And you go that way. And then it hits you again. This time it's not as bad. Not quite as much despair, not quite as long, but it's very much like that.
Biochemistry professor Nancy Speck is a cancer researcher noted for her work in blood cell development and leukemia. She is also a breast cancer survivor. As a scientist, she looked for facts. As a patient, she found that facts were not always available.
Before you have some serious illness, everything is so straightforward. You walk into a physician's office and you say, "I have a sinus infection," and they say, "Here's a prescription for an antibiotic." And there's really not much debate about what the right course is, but cancer treatment is quite different.
At the age of 46, with 3 daughters grown but a young son still at home, Nancy went in for a regular mammogram.
The technician came back in, and with that alarmed look on her face, and then she took more pictures, and then she came back in bringing the radiologist with her. So that was a little more frightening because I'd never seen him before. And he said, "I'd really like to do an ultrasound. I'd really like to do it right now."
After the ultrasound came a biopsy. The suspicion of cancer was confirmed.
Coming to terms with the news that you have cancer requires a very large reorganization of yourself. And, there's a lot of despair and a lot of some anger and a lot of why me, and I can't believe it's me. I can't believe I am lying on this table having this procedure done. This just cannot be me.
On the day of diagnosis, Nancy was faced with her first decision on treatment.
There were basically 3 options at that point. There was a lobectomy, followed by radiation, a mastectomy, or a mastectomy with reconstruction.
In a mastectomy, the entire breast is removed. Nancy chose the more conservative option, lumpectomy, where surgeons remove only the tumor and some of the tissue around it. Her doctors also removed one lymph node under her arm. When breast cancer spreads to other parts of the body, the lymph nodes under the arm are usually where it shows up first. With dye and radioactive tracers, doctors can determine which of these nodes will probably become malignant before the others. That is the one they remove and send to the laboratory.
And then they look at that node very carefully, and if that node is negative, that means you have a node-negative tumor, and you're done as far as surgery is concerned.
But Nancy was not done. The node that received the most drainage from the tumor, her sentinel node, contained a small cancerous growth.
As we discussed, Nancy, one of your lymph nodes has a little tiny tumor metastasis in it. It was about 1 millimeter in diameter, which obviously is a really tiny metastasis in your sentinel.
The question now was whether to remove all the lymph nodes under her arm to prevent further spread. Removing them would significantly reduce the risk of recurring cancer, but the surgery itself could have major side effects.
The most significant risk, I think, is lymphedema, which is it's kind of a disruption of your lymphatic flow, and you tend to accumulate then lymphatic fluid in your limb, your arm, for example. And then I went to see the surgeon to discuss what to do from then, and he said, you know, it's a very small metastasis. I would recommend that you not finish the node dissection. I think it's going to be just fine the way it is.
That possibly the chemotherapy, if it's going to impact on tumor cells in other places of your body, could also potentially kill tumor cells that might be in some of your lymph nodes, okay?
Then my oncologist calls me up and he says, just to give you a heads up, the radiation oncologist thinks you should complete the lymph node dissection. So I had two physicians on my team of 3 who disagreed with each other about what the next course of action should be.
Not sure which doctor's advice to follow, Nancy consulted 10 more physicians, hoping for some kind of consensus. They split down the middle.
I had 5 physicians telling me one thing and 5 physicians telling me another thing, and I realized it was an outstanding question. If these people couldn't decide, it was for a reason that their data wasn't good enough.
A clinical trial was underway to provide those data. It would compare the progress over time of women who had the lymph node surgery with those who did not. But the results would not be known for several years. By participating, Nancy would be helping to find answers, not for herself, but for others down the road.
Initially, I thought, no, I don't want to participate. I said I do my bit for science, frankly. But I really felt differently about it when I came to realize how controversial the issue was in the field. And, you know, not only that, but there were a lot of women who came before me that saved me from much more radical surgery because of their willingness to participate in a clinical trial and to be randomized and have their fate determined by the flip of some coin. And that's how medical science progresses, is because people were willing to do this. So I felt like I was paying back a debt to women who came before me and doing something for, my daughter's generation.
When Nancy entered the trial, the decision on whether to have all her lymph nodes removed was made for her. She was randomly assigned to the surgery group and underwent the full lymph node dissection.
I knew when I went into it that no matter what the outcome was, I was going to go through with it. I wouldn't have enrolled if I hadn't been willing to go whichever direction that coin flipped.
The operation did leave her with lymphedema, but fortunately it was mild. She now wears a special elastic sleeve to control the swelling. She also has permanent numbness in the back of her arm. But these are side effects she says she can live with. She found the next step more difficult. After the surgery, Nancy was scheduled for 6 rounds of chemotherapy over a period of several months.
Of all the different forms of the treatment or the aspects of the treatment, it was chemotherapy that I hated the most. Surgery wasn't a problem, really, but chemotherapy, you felt like you were being poisoned.
Nancy felt ill much of the time. She lost her hair, Her immune system became impaired and she was hospitalized twice for an abscess in her breast and then for an infection in her arm at the point where the drugs were infused. Despite her weakened condition, she returned to her lab as often as she could. Halfway through the treatments, Nancy recalled visiting another medical center where patients like her were advised to have 4 rounds of chemotherapy instead of 6.
So here I am, 3 rounds into a 6-round procedure and having access problems. So the question that I posed was, what is the evidence that 6 rounds is really that much better than 4? Turns out they'd never been compared head to head. There's no data out there. Those trials are ongoing. In the end, I have a friend who's an oncologist. I think he had the most influence on me. He had asked a couple people as well, and he said, I really wish you'd do this. It was as simple as that. You know, I really wish you would do this. I would feel better if you did all 6 rounds. And I think it was kind of the path of least regret. So my rationale was that if after having done all of it, if I ended up with metastatic cancer, I at least couldn't look back on it all and say, well, gosh, what if I had done 6 rounds instead of 4 rounds? Maybe I wouldn't be in this position.
Nancy completed all 6 rounds of chemotherapy. Next, her doctors recommended radiation therapy every day for 6 weeks to destroy any remaining tumor cells in the breast. This time, they all agreed, but Nancy decided against it. Instead, Nancy chose to have a mastectomy and breast reconstruction. She had rejected this option at the time of diagnosis, but the picture was clearer now, and in this situation, the risks were known.
So if you have a lumpectomy and radiation, let's say, for the original reconstruction, you have a 12% chance of recurrence. But if you have a mastectomy, it's more like a 2% chance of recurrence.
For some women, retaining the breast is worth the increased risk. For Nancy, it was not. But there were other factors, too. By now she had learned that doctors could disagree, that good evidence was not always available, and that when the path was not clear, her own instincts could be the best guide.
I saw reconstruction as something that was going to be a big bang up front, but from which I'd get better every day. I used an enormous amount of emotional energy over the course of those, several months, making these decisions. And, and I'm a scientist, and that I wonder what it's like for women who have no experience to go through this process, because I frankly found it a bit overwhelming. In the very beginning, when I was first diagnosed, I was convinced that I was going to die very soon. Nobody could convince me otherwise. And then, as time went by and I was still here, you wake up in the morning and you're still here, it begins to dawn on me that, maybe it will be okay. Maybe I'll last long enough to see this kid grow up. Yeah, but the knife has a serrated edge on it, Nate? No, upside down. You got it upside down. Flip it upside down.
Every 4 months, Nancy visits her doctor for a follow-up exam. It's been 2 years since the diagnosis, with no signs of recurrence so far.
You end up learning to live with the fact that you have cancer, or had cancer, or may have cancer again. And as horrible as it seems to somebody who's just now receiving this diagnosis, I can tell them you will get to a point where it just becomes part of your life, part of who you are. And there's actually good things that come of it. You wake up in the morning just so glad to be there another day. It's a gift. If I actually survived the experience, it would have been a gift. It would have been a good thing to go through. If I die in the next 5 years, I would have rather forgone that experience, frankly.
As a reader, I want to know his motivation for it. It doesn't seem big enough to me that you haven't given him quite enough reason.
Dean Whitlock is a writer. So is his 17-year-old son, Ross, who's working on his second science fiction novel. Dean was in the delivery room when Ross was born, but not in the way he'd planned.
It was the typical case where I'd gotten the chemotherapy, and a week later I had spiked a fever and had to go in and start getting antibiotics. So I was in the hospital, and it turned out she needed a cesarean. So I was there with her for the cesarean in the operating room. hooked up to my IV while she was hooked up to her IV. And, in my Johnny, and she was in her Johnny. I can remember holding my son. Now, anybody's going to remember holding their son. But not many remember when they're hooked up to an IV, and are about to throw up.
3 months earlier, when his wife Sally was 6 months pregnant, Dean had been diagnosed with APL, acute promyelocytic leukemia. He was then 36 years old.
I walked in, and the doctor told me I had leukemia, and it was just this burst of panic. I still, get the chills when I think about it. It's the flight-fight syndrome, only you don't think you can fight, And the doctor tried to help me out by saying, we've got good control over this one. There are, people who survive. I said, okay, there's no reason why I can't be one of them. I'm going to work towards that. I don't need to know how many. I just need to know some do.
Like many writers, Dean has held many different jobs, most recently as Director of Public Relations, and almost everything else, for a small, old-fashioned circus. There's a strong connection between the magic and playfulness of the circus and the path Dean chose to combat his illness.
It's one of those things where you have to develop a method to survive, and I think laughter's the way to do it. People come in, how you doing? Oh, I'm doing fine, I'm fighting it. And down inside, you're just curled up in a little ball and crying all the time. And so you have to learn to laugh again. And you have to watch funny movies, read funny books.
When Dean was first diagnosed, his doctor told him about an ongoing clinical trial to determine the most effective dose of chemotherapy.
And so they were giving some people lower than usual doses, some people usual doses, and some people very high doses to see if it made any difference. I said, well, okay, I'll participate. And it just was, luck of the draw, a random thing that I'd gotten the very high treatments. And I figured, well, okay, the high treatments are probably going to be better than the low treatments, so I don't mind. I'll go ahead with it.
The chemotherapy for APL back then had severe side effects. The higher the dose, the more severe the consequences.
It's supposed to kill your bone marrow. And hopefully not so much that you die outright. And then, they then are very careful not to get you infected with something because you have no immune system when you have no bone marrow. You also have no platelets, so you can bleed to death real easily if you have a nosebleed, and I had several of those.
Despite several close calls, Dean survived his first series of treatments. But even at high doses, the chemotherapy did not wipe out the disease.
They came back and said, well, you're not in remission yet. We're going to have to do this again. And that's when my hair started falling out. And I went into such a depressed state that I could hardly open my mouth without feeling like I had a lump in my throat, was about to cry. And I knew that I was going through severe clinical depression. If anybody had tried to diagnose me at that point, they would have said, yep, this guy's depressed. And I just came out and said to Sally, I can't talk without crying. I'm depressed. I've got to laugh again. Get me a funny book. And she went right down to the bookstore and came back with Calvin and Hobbes, Shoe, Bloom County, The Far Side, and the Marx Brothers, and Charlie Chaplin, and the Boston Chuck Jones, and, Daffy Duck and the Roadrunner and all that. And the nurses brought in the VCR, and I started my treatment from that point on. That was a turning point.
Along with the laughter, Dean also tried visualization, or positive imagery.
Part of the imagery is to visualize your immune system as a very aggressive creature, and to visualize the cancer as being something that this aggressive creature hunts down and shreds, chews up, destroys. I would always visualize myself with my child, my son. I didn't look like anything that he turned out to look like, but I could visualize myself with this kid. And that was very, very helpful in fighting this. And in doing what I could do to to fight the disease, to stay optimistic, to look to the future.
Looking to the future, says Dean, was better than focusing too closely on the present.
It's important to know what part of your body is affected, and it's important to know what you can do yourself to help. But don't ask how many people survive. Just know that some people do.
Partway through Dean's second round of high-dose chemotherapy, his doctors gave him a break so he could recover some strength before completing the treatment.
So I went home, and I came back in 2-3 weeks later, and I was in remission.
Dean's oncologist had told him that medicine could only do 40% of the healing, and that the other 60% would have to come from him. Dean believes that meditation, visualization, long walks, and laughter made up his 60% share.
You know, don't turn down the chemotherapy or the radiation, you know, to take the Western medicine, but don't turn down the other stuff either.
After he had been in remission for over a year, Dean accidentally learned the truth about his odds of survival.
Without realizing that I was avoiding it, my doctor said, here's the statistics, and he showed me these graphs. And immediately I could see this graph that plummeted, when you like this.
Come and learn about our circus!
Dean is glad he never knew how slim his chances actually were. His remission has lasted for over 15 years. For all intents and purposes, he is considered cured.
When things happen, I've been laid off a couple of times since then. I've lost both of my parents since then. Your perspective has changed. There's stress, there's aggravation, there's agony, there's grief, but the fact is that you can look at it from the point of view of consider the alternative. What if you've missed it completely? And you don't want to miss it. Everything. It's just too wonderful. It's all worth living for.
Either cellulitis or varicella infection.
Every appointment was incredibly important to me, and I would relive the whole experience afterwards and try to remember what they said and the inflection of their voice and, what was between the lines. And I wonder if they know that. Just how much a patient clings to their words and how important it is for them to be hopeful for you and compassionate towards you.
Just by the way I felt after he would come and talk to me. He was warm, he was human, brotherly / fatherly, and he had a way of just making me think, I can do this. I can work with him to make this happen. So I just felt more positive about my ability to survive because he was my doctor.
Cancer patients are unique to me because I take care of a lot of cancer patients, and I see a lot of bravery, I see a lot of wisdom. I must tell you, I learned something from virtually every patient I walk in and see.
Fruity or pepper, blue pepper. Now put the cup to your lips.
It is almost always the so-called civilians, family and friends, who assume the emotional burden and meet the practical demands.
I had a daughter who was living at home. She was a senior in high school, and she's the type of person who wants to do things, and so she managed it all by running the house. Well, my husband's wonderful, but he's kind of disorganized, and she did everything. She did the shopping and the cooking and the cleaning and the watching of the young kid and, my son. And she says, I missed a lot of my senior year in high school, but I wouldn't have it any other way.
My mom and dad are here to take care of me, and my brother has been a dream. He always has. He's my best friend. So he's been very helpful throughout the whole process.
People I hardly knew, people that were acquaintances, people I admired and loved or didn't know well. I felt like I had been pitched off a stage at a rock concert when Tim died, and all these people just held me so that I wouldn't fall on the floor.
People came and offered to pray for me, and I'm an atheist, but I knew that they were doing it because they loved me, and I said, yes, prayer is an act of love. Pray for me.
Cancer irrevocably changes a person's life, but not necessarily for the worse. I would say the other thing I've learned as a clinician working with cancer survivors is, again, that sense of enormous resilience. Over and over again, what we've heard from survivors is, I've taken this experience and changed my life. It made me look at how I was living my life, and I've made some very important decisions for myself. I think I'm living more fully, a richer existence because of cancer. Wouldn't have wanted it to happen that way, but this is the gift that it's been to me.
16 to join students doing military training in the airfield. Day after day, he tried to
Stay tuned as part 4